Hi, I'm Maya,
And I'm Noel.
and we will be talking about atopic dermatitis and a pharmacist's contribution.
We will be talking about prevalence and risk factors, the pathophysiology, etiology, and symptoms, and the role of the pharmacist in treatment.
So, atopic dermatitis is a type of eczema that is characterized by chronic inflammation of the skin. It affects children more than adults and can follow a chronic relapse-remitting course. There are varying types of eczema, which include contact dermatitis, seborrheic dermatitis, and stasis dermatitis. For this presentation, we will be talking about just atopic dermatitis in more depth. So first, we will take a look at prevalence and risk factors.
Here on the slide are some statistics on the prevalence of atopic dermatitis. In the United States alone, about 1.6 million people have some form of eczema. Approximately 1 in 10 individuals will develop eczema at some point in their lifetime, and it peaks in early childhood. On average, it affects up to 12% of children and 7.2% of adults. Individuals of all races can experience different forms of eczema. Native Americans and those of Asian or Pacific Islander descent are affected the most, with 13% of individuals of both races being impacted. 11% affects those of African descent, and 10% of those who are white are impacted.
So environmental factors, particularly skin irritants, pose a risk factor. These irritants include wool, synthetic clothing, detergents, cosmetics, dust, chemicals, as well as extreme temperatures, very dry or humid air, and lack of moisturizing after bathing. Those who are allergy prone are more likely to develop atopic dermatitis, and finally, the greatest risk is for infants and children.
The most common symptom of atopic dermatitis is pruritus, which just means itching. Presentation is dependent on age. So, if the patient is 1 year old or less, they would have plaques on their face and extremities. An older child would have patches on flexor surfaces, so their elbows and knees. Adults, on the other hand, will present with dry and scaly patches on their extremities. The diagnosis of atopic dermatitis varies depending on the type. There is no definitive lab test to aid in diagnosis. However, there is a scoring atopic dermatitis index, which practitioners may use in their diagnosis. Next, we will be talking about the pathophysiology, etiology, and symptoms of atopic dermatitis.
Genetics is a big factor in whether or not an individual will experience atopic dermatitis in their lifetime. There is a protein called filaggrin, which plays a role in the skin's barrier function. Its normal function allows it to bind to keratin intermediate filaments to cause aggregation into densely packed bundles. With the loss of this function due to a mutation, this leads to filaggrin deficiency. This deficiency leads to abnormal structure and physiology of the epidermis, which therefore leads to an increase in transepidermal water loss and dry skin.
Many triggers of atopic dermatitis come from the environment. Aeroallergens, or airborne allergens, are one of the big triggers. They can come from indoors or outdoors. Indoors, you have dust mites, which are a common trigger. Allergies indoors can come from cats and dogs, but more common from cats than dogs. Outdoors, there's pollen, which is a common trigger for atopic dermatitis flare-ups. A second environmental factor is UV radiation. Some evidence suggests that the lack of UV radiation can cause a flare-up. A study with infants found that infants with eczema were found to not have much UV light exposure compared to children who did not have eczema.
Stress is another key factor in the flare-up of atopic dermatitis. Those who have higher levels of stress have an increased prevalence for eczema. This was proven in a Korean study comparing participants who had varying stress levels. Those with higher levels had an increased prevalence of eczema compared to those with a lower level. When a person is introduced to a stressful situation, they undergo a process called fight or flight. In response, the body produces cortisol and epinephrine, both of which are stress hormones. The issue is that the release of too much cortisol can dysregulate the immune system and therefore promote inflammation of the skin. The last main concept that will be discussed is the role of the pharmacist in treatment of atopic dermatitis.
There are many key roles that a pharmacist can play in treating someone with atopic dermatitis. Arguably, a pharmacist is the most accessible healthcare worker available to ask questions to. They can also recommend varying over-the-counter treatments and can help refer patients to primary care providers.
There are many available treatments for atopic dermatitis. Although there is no cure, there are many over-the-counter options. Emollients, which work to soothe and soften the skin, such as creams and ointments, are available. Another type of treatment is warm daily bathing, which is found to be helpful in treating a flare-up and to help maintain skin hydration. For some prescription treatments, those that are available are topical corticosteroids, topical calcineurin inhibitors, which are immunosuppressants that help manage autoimmune conditions, UV phototherapy, and antibiotics. It is important to understand that since there is no cure for atopic dermatitis, these treatments only treat the symptoms.
Available over-the-counter treatments include emollients. These can be ointments, creams, or lotions. We also have mineral oil. Examples of ointments are Aquaphor and plain petroleum jelly, like Vaseline. Examples of creams are Lubriderm, Aveeno, CeraVe, Eucerin, and Vanicream. The least protective are the lotions, and the most protective are ointments, and in the middle are creams. As a result, lotions should be avoided since they lack hydrating properties. Ointments contain the most oil, making them the best choice for dry skin. Creams have some oil, while lotions and gels contain more water. Application of emollient should be within 3 minutes of bathing or showering for optimal occlusion and hydration of the skin. The daily use of emollients can help with limiting the use of prescription medications. Furthermore, it increases the time until an atopic dermatitis flare-up when compared to not using an emollient.
Prescription topical agents include topical corticosteroids like cortisone 10 and topical calcineurin inhibitors like Elidel. Topical steroids work by reducing inflammation in the skin. Topical calcineurin inhibitors interfere with the production of a number of inflammatory substances that contribute to skin inflammation in atopic dermatitis.
It is important to understand causes of atopic dermatitis to possibly find a cure. Current treatment regimens only treat the symptoms. With a definitive cause, treatment can be focused on curing and not just alleviating symptoms that could potentially flare up again. Furthermore, better treatment options can promote adherence, and since patients are seeing a consistent result with their regimen. And lastly, the ultimate goal is to provide better quality of life to patients with atopic dermatitis.
So to conclude, we will go over some key points again. Atopic dermatitis mainly affects children. The most common symptom is itching or pruritus. The specific cause of atopic dermatitis is yet to be identified, but research is suggesting genetics, environmental factors, and stress to be the main contributors. And lastly, pertaining to the role of pharmacists, pharmacists can aid in the identification of atopic dermatitis and recommendation of over-the-counter medications to alleviate symptoms.
Thank you for viewing our presentation. We hope you enjoyed it and have a great day.